Hi everyone, it's Cookie Lou in Arizona. It is a cloudy day in Arizona. We've had some rain, we've had some wind, we've had trees tumbling down by the dozens. Every day I see another branch or another tree that's been uprooted, fell down. Gardeners are making a fortune, they're cleaning it up. Boy, I'll tell you. But this is the monsoon season out here, so it's pretty normal for this to be happening at this time of year. Okay, what have I been up to? I went to my first post-operative support group at the Bridges Center for Weight Loss Management, which is affiliated with my surgeon. And before surgery, prior to surgery, we had to go to these classes, 101, 102, pre-op, to kind of get all the particulars about surgeries. What surgery does what the risks are, the whole gamut of things you needed to know. And being that this was my second surgery that I was approaching at the time, I pretty much knew all that, but it was mandatory to go, and I would have went anyway, just kind of hear what they had to say. So this was the post-operative support group, and I talked with my doctor when I went to see him a month ago for my sick. Well, it was kind of 5.5 month visit, and I went 2 weeks ago for my 6 month visit with him. But I had discussed with him about how duodenal switch patients are so rare, and we really don't have anybody to really support our type of surgery. It is nowhere near like, just having a gastric sleeve. It's completely different from a gastric bypass. And because so few surgeons do it, so few patients request it, there's just so few of us out here. I mean, like my doctor only did about maybe 200 in his whole 15-year career. And there are some surgeons out there that have done, over 1,000. And they really have skilled hands at it. And I would have preferred to go to a doctor who had more experience with the duodenal switch, but the only ones that had it, to my research, were in California. And they requested that I stay there, at least 14 to 20 days, and that would have just been too expensive for me. Flying there, getting a hotel room or an apartment would have been thousands. California, I checked, trust me, thousands. Renting a car, getting food. And then there's always that situation that once, you get released from the doctor and you fly home, even though Arizona is close to California, it's still an airplane away or a long car ride away. You're still in a situation where if something goes wrong and you need to get to your doctor, you got to get on a plane to do it. And there's no support groups because you have to get on a plane to do it. So I decided to just take my chances and have the local surgeon here, one of the few that does a duodenal switch, who has a good reputation as being a good surgeon and general surgeon. And he's with an associated partner, Dr. Fang, who also has got a good reputation for being a good surgeon, bariatric and general surgeon. And, so I went to Dr. Schuster. So anyway, when I was talking to Dr. Schuster about how there's just so few of us here, and that I wanted to know why we didn't have a support group, or why the people facilitating the support group doesn't focus more strongly on the duodenal switch patients. And he really didn't have anything to say about that. It's just that they kind of clump the DS patients in with the gastric bypass patients because it's pretty much the same type of biological intestinal digestive situation. It really isn't. I mean, it's similar, but it really isn't the same. And they'll just make a few additional suggestions for a DS patient. For instance, more vitamins or less fat. And there's a lot of people that are DS say, "Oh, you got to pop up that fat." Well, I can't pop up the fat because when I do that, I have problems in the bathroom, and the gas, of course, is a symptom with duodenal switch. It can't be helped. There are certain things I'm investigating to try and see what I could do to help with the gas and the loose stools and to kind of alleviate it just a little bit because it can. But a lot of it is, if I eat something out of sorts, I'm going to pay the price. But anyway, when I asked him about that, he told me, well, if you really want to have a support, like meet and greet social support type group for DSs, you should start one. I thought, I have to start one. So I went to the meeting, and I talked to the dietitian about it. And she really wasn't very helpful. So I went in to talk to my post-operative advocate, Kara, really sweet girl. And I talked to her about it. And she says, Lucille, she says, I have been trying to get more support, more post-operative support for patients in general. More group activities, more meetings where there's open discussion, more suggestions on how to help them with their problems and their struggles. But she says, and the DS group is something that I wanted to try to, to expand on. So I explained to her what I wanted to do, and I gave her my information, and she said that she was going to present it to her director and see if they can get something going, either through Bridges or maybe something where they can set up where I could pretty much get something together. And she would be more than happy to meet with us wherever we meet and help me facilitate it. So anyway, they're working on it at Bridges. The reason why at this point in time we couldn't get, and I don't really understand this, they couldn't let me pull together a support group, facilitate or just meet in a separate entity from whatever they normally schedule for support groups. According to the dietitian, it's because of liability. The insurance wouldn't cover us because we're a separate entity from Bridges. And I says, well, that's why we shouldn't be a separate entity from Bridges. Bridges should have something specifically for DSers. And if you have to toss it in with the gastric bypasses and the sleevers, then do it. But they have to have more knowledge about what the DS patient needs after surgery to help them through their problems. They don't. They don't have anything to say about it. They'll skip through it, or they'll just, like for instance, I was asking my dietitian about, the gas. There has to be something I could take for the gas. She suggested Beano because it's an enzyme that helps the digestive tract. Yeah, but Beano is pretty much for beans and legumes and those types of carbs. For lower intestinal gas that produces expulsion of gas, you need a different type of thing. If you have a problem with irritable bowel syndrome, which I do, which causes loose stools to begin with if I have dairy. I'm trying right now to really eliminate all dairy. I've been doing that for a while. But sometimes, you're eating cheese or you're eating something. It's not so much the butter. I just still use a little bit of butter and a little bit of olive oil when I cook, but not as much as I was because I was using too much of it and it was affecting me in the bathroom. There are other things that you need to probably take something specific for a milk intolerance, something specific for bean intolerance, so you're always popping all these pills. I did my research and they say that activated charcoal is something that's really good to take. It really absorbs all the gas, the enzymes in it, whatever absorbs the gas and prevents, a lot of breaking wind. However, it also absorbs everything else, like, it aids in malnutrition because if you have something in your gut that you're digesting for nourishment, it's going to suck that up as well and keep it from your body. So there's a lot of things that, you have to take it 2 or 3 hours before any medication. You have to take your calcium, 2 hours before any medication or antibiotic. There's so many things that you have to keep weighing um, as to when you take them so that they don't counteract something else that you're taking, antibiotic or whatever. So I figure I ordered the activated charcoal, and I got Latase. Latase, is it called Latase? I have it near the room. For milk intolerance, even though I don't take the milk. But if I should happen to go to an Italian restaurant and I'm eating something with ricotta cheese or a lot of mozzarella or something like that, I'll take it before I eat my meal. I'll take it, I think, 2 hours after I eat my meal to kind of help me not get a response with the irritable bowel. Just to kind of I'm just trying to supply myself with everything that I can, have it on hand in case I'm in a situation where I want to, prevent that kind of discomfort. And I'm also taking Devarom for foul smells. You chew that a couple of times a day, and I think that does help a little bit. It's an internal deodorant. Devarom is called. Doctor told me, take that because that does work. I'm getting good, reports on the Devarom. But there's a lot of things that come with having a DS. But the good note is, I'm only 12 pounds away from Wonderland, people, and I've never been 12 pounds away from Wonderland. After any kind of surgery I've had before. So. I'm happy about that. The weight is coming off. I've had a couple of weeks where I stalled, but nothing to complain about. I know that iron tablets also helps with loose stools. But my doctor told me, he said, Lucille, if you already have irritable bowel and you're lactose intolerant, it's going to get worse with the DS. Just heads up on that. That's the side effect of it, because you have a short bowel now, a short intestinal tract, and everything is digested differently, and that's just it. Now that's the name of the game. You will have malnutrition. You've got to take those vitamins faithfully, and I've got a little slippage on that. I usually forget to take maybe one dose of the my vitamins at night, and I'm maybe, if I'm lucky, I get in 3 doses of the calcium compared to the 4 that's required for DS patients with my dietitian. But a lot of people that I know are only taking 1,500 milligrams of calcium, and my doctor's dietitian's recommending 2,000. So as long as I get at least 1,500 in, I'm okay. He set me up for another blood test. That's happening probably next week. And we'll see where I am with that, because first time he took the blood test was just 3 months after surgery, and I was really on point. I had my alarm clock, and my phone going off every hour to remind me to take something, some vitamin or pill or calcium shot or something. And then I stopped setting the alarm clock, and I started not missing a couple of dosages. So, got completely off track on what I was going to say, and I'm already, 13 minutes in? So I think I'm going to stop it at this point and pick up another video, okay, part 2, because I do want to discuss something briefly with you about something else I discussed regarding DS patients with my doctor. Okay, see you in part 2. Bye.